Hi, this is Robert Carlson with Brave Defender Training Group. Today what I want to talk to you about is a vitally important skill for law enforcement officers to have, and that's tourniquet application. More specifically, being able to apply a tourniquet onto another individual, or what we commonly refer to as buddy tourniquet application. Being able to apply a tourniquet on ourselves is a critical skill for us to be able to have. However, statistically, we know we are more likely to have to apply a tourniquet onto another individual, such as a wounded officer or a member of our community. Now, nothing we discuss in this video today is designed to or meant to replace receiving good hands-on training. I encourage every officer to get out there and enroll in a good hands-on tactical medical class so that you could develop the skills necessary to be able to save not only your life, but the life of somebody else. Now, as we discuss tourniquets, there are several principles that we need to keep in mind. Our first principle is our tactical concerns are always going to outweigh medical concerns. If we have an ongoing threat, we need to deal with that before we start trying to treat any injuries. We have to create a safe environment for us to be able to operate in. Also, we want to make sure that we're only using tourniquets on life-threatening arterial bleeding from the extremities. We just simply won't have enough tourniquets available to us to use on every single injury. So we want to prioritize the arterial bleeds from the extremities that are going to pose that immediate risk to our casualty dying. When possible, we want to try and always apply a tourniquet behind some form of cover. Because we're going to have to holster our weapon and we're going to be very attention focused on the injury, it's just not going to be possible for us to maintain our situational awareness or be able to provide cover for ourselves. So we always want to try and do this behind some sort of cover or concealment if we're able to do so. Another thing that we need to keep in mind is I don't know how long this casualty has been bleeding for prior to me getting there, nor how much blood has been lost. So one of the first things I need to do once I get behind that cover is I need to slow down this blood loss in order to buy me time to retrieve my tourniquet. We can do this through a process called manual pressure, where we apply pressure to the artery and compress it against a large bone, and that's going to slow down and start restricting that blood flow, buying us time to be able to retrieve our tourniquet. Prior to applying the tourniquet, we want to make sure that we clear the area of any obstructions. We commonly refer to this as conducting a pocket sweep when we're talking about lower extremities. We want to make sure that there's nothing that's in the casualty's pockets, such as cell phones, wallets, or keys. They're going to create a barrier from that tourniquet being able to restrict that artery. When we apply the tourniquet, I want to put it as high as possible onto the limb without going over any joints. And I want to make it as tight as I can possibly get it where it occludes that blood. So we commonly call this high and tight. And once it's on, I'm going to continue to tighten it until the bleeding has stopped. And then I'm never going to loosen or remove that tourniquet until the patient is at a hospital or other treatment facility, and only once a doctor chooses to do so. When we apply these tourniquets in the field, we are doing what we call a hasty tourniquet, meaning I don't have time to visualize the wound. There's a time and a place for that. But right now, what I'm trying to do is stop this bleeding. So I'm going to apply this tourniquet over the top of the clothing because I need to get it on as rapidly as possible. Now, when we have a casualty that has any kind of life-threatening arterial bleeding to their lower legs, this is one of the most critical injuries that we need to deal with. The artery that runs through the leg is extremely large and blood loss occurs very, very rapidly. So one of the first things that I need to do when I approach this casualty is I need to start slowing down that blood loss. The best way that I'm going to be able to do that is by applying manual pressure onto the femoral artery to start restricting blood flow. So I'm going to take my knee and use that to compress the artery by applying pressure right on the femoral artery where it joins into the pelvic girdle. Now you'll notice as I do this, I'm going to approach the casualty and I want to keep my hips open to the injury. I need to be able to see what I'm doing and kind of create an open workspace. So I'm going to take that knee and come up and drive it straight down into the pelvic girdle, applying firm, solid pressure onto that artery. This is going to now buy me time to be able to go to my gear and access my tourniquet. Before I apply the tourniquet, very quickly I want to do a pocket sweep and make sure that there's no bulky objects in the pocket or a drop holster that's going to get in the way. Now in this scenario, we're using a soft tourniquet. So on the soft tourniquet, all I need to do is unclip the buckle. I can then pass it underneath the knee in that cavity or that air gap that's there, and then scissor it up as high as I can get it onto the extremity. I'm going to lock the buckle back in place, and I'm going to grab the circumferential band with it orientated towards myself, and I'm going to pull it as hard as I can, getting as good solid of a bite as I can get. I'm now going to take the windlass and start turning it, and I'm going to continue to turn it, getting that tourniquet as tight as possible until the bleeding stops. Once the bleeding has stopped, I can secure the windlass in the windlass retention clip and then lock it in place with the locking clip. Now hopefully this has restricted the blood flow, but on a lower extremity, more than likely it hasn't. It's probably going to take 2 tourniquets on a lower extremity. So when that happens, I can apply my second tourniquet. Now in this case, we're going to use a cat tourniquet. I'm going to go ahead and open that tourniquet up, and just like the other tourniquet, I'm going to pass it up underneath the knee and scissor it in place. Now when I apply this tourniquet, I want to get this one as high as possible. So depending on how I got the first tourniquet on, I may remove my knee and get this tourniquet over higher than the initial tourniquet, grabbing the circumferential band, running it back to the buckle, pulling it, securing it in place and securing that Velcro, and then now taking that windlass, turning it until I can't turn it anymore or until the bleeding is completely stopped, and then locking it in place. Once this is done, I should have the bleeding effectively controlled on this lower extremity. If our casualty has arterial bleeding to an upper extremity, such as the arm, we have a little bit more time to deal with this. This is still going to be significant blood loss, but it's not as critical as it was with the lower extremity. So if I need to apply manual pressure prior to applying the tourniquet, I can do this with either my hand by coming across, getting my fingertips inside of the brachial artery and compressing that against that large bone in the upper arm. Or I could use my knee to do this, but if I use my knee, it's going to block my ability to get that tourniquet as high as I need to. But using the knee is a good option if I don't have a tourniquet available and I really need to completely stop that blood loss. Most situations though, I may not need to apply manual pressure to the upper arm because I can just quickly get that tourniquet on. So as I approach this casualty, I'm going to retrieve my tourniquet. Again, we're using the soft tourniquet. I'm going to simply slide the tourniquet over the extremity. I'm going to get it up as high as I can possibly get it onto the casualty's arm without getting up onto the shoulder joint. Grabbing the circumferential band, keeping it where I'm pulling towards myself, I'm going to pull the circumferential band as hard as I can, get that tourniquet as firm as possible against the patient's arm. Now I can take the windlass and begin to rotate it, and I'm going to continue to turn that windlass until it is completely tightened and I don't see any more arterial bleeding coming out of that artery. Once it's bleeding has been stopped, I can go ahead and secure the windlass into the retention clip and then lock it in place with the locking device. Typically on an upper extremity, we only need to use 1 tourniquet. However, always be prepared in case that initial tourniquet was not effective. One of our final considerations regarding tourniquets is after any patient movement, we want to make sure that we go back and reassess our casualty and check those tourniquets. We just want to make sure that those tourniquets didn't shift or come loose during that casualty movement. All right, everybody, hopefully you found something in this video informative and that you were able to learn something in order to be able to keep yourself, your partners, and your community safe. As always, if there's anything that we can provide to you or information that we can give to you, please do not hesitate to reach out to us. And as always, be safe.